Hello, I'm Dr. Francesca Wood, a clinical psychologist in the Intensive Care Unit, or ICU, at East Surrey Hospital. If you're watching this video, it's because you have a loved one who's currently in ICU with coronavirus or COVID-19. This brief video aims to provide you with some basic information and coping strategies that may be useful at this really difficult time. We know that having a loved one in intensive care is an incredibly distressing time, especially during the pandemic when visitation is limited. So the reason why your loved one's been admitted to ICU is because they've become seriously unwell with what is or what appears to be a severe chest infection due to coronavirus. The fact that your loved one has been admitted to ICU tells us that the situation has become very serious. However, please know that your loved one is not alone. They're being cared for by doctors and nurses who are incredibly skilled, kind, compassionate, and experienced. We will do our best to support your loved one as they try to recover. I'm now going to run through 4 key things which you may find helpful throughout this time. The first one is caring for yourself. You may be feeling emotionally very up and down, perhaps feeling helpless, frightened, or even numb. Whatever you're feeling is incredibly normal and okay at this time. Whilst looking after you may not be the top of your priority list right now, the best thing you can do to help your loved one is to take care of yourself. So we encourage you to maintain contact with family and friends using the phone or internet. Try to eat and drink, even if you're not particularly feeling like it, and take time to rest and have a break. You may also wish to limit your access to the news, especially with so much in the news at the moment about the virus. It can be helpful to find one reliable source and stick with that rather than looking at multiple outlets. I recommend searching gov.uk/coronavirus for up-to-date and reliable information. Secondly, updating family and friends. Naturally, friends and family will be very concerned about you and your loved one, and they'll want to know how things are. You may appreciate their concern, but it can be incredibly tiring and emotionally draining if the phone's ringing all the time. Passing on information by group email, group WhatsApp, a group Facebook page can be easier. Or you could speak to one person regularly who you trust, and they can pass information on to others. Thirdly, keeping a diary. You may wish to keep a diary of what happens whilst your loved one is in hospital. This could include medical updates that you receive from the team, events on the news, or general updates on family life. You may find this helpful in the future to look back on, and it might help you to process the information in a way that's a little bit too difficult to do right now. Not all of us like writing, so you may find other ways of creating a record whilst your loved one is in hospital, such as photographs, newspaper clips, or voice recordings. And finally, communicating with a child. Communicating information to children about a family member in intensive care can be difficult. It's really important to communicate clearly and in a straightforward way, using words and language that the child uses if possible. Encourage the child to ask questions and know that when they stop asking questions, maybe they've had enough of talking about it for now. Be honest if you don't know the outcome of what lies ahead, but also try to offer reassurance. For example, saying, "Grandma's really poorly, but the doctors are doing everything they can, and she's in the safest place right now." It may also be helpful to do an activity with the child whilst you're having these conversations, so playing with toys or doing some baking, depending on your child's age. And remember, it's absolutely okay for a child to see you upset. This will help them to learn about normal emotional reactions and encourage them that it's okay to have those emotional reactions themselves. Thank you for listening. For more information, please visit icusteps.org/information.